Hey, what's going on, everyone? This is Dr. Ryan Balmes, sports physical therapist with Endvr Health. Thank you for listening or watching the Endvr Health podcast. I really appreciate all the feedback from the first one. If you haven't done so already, make sure you click to subscribe or however you like to listen to your podcast. Also, definitely check us out at our website at www.endvrhealth.com. That's ENDVR Health.com. Also, check us out on our Instagram and Facebook page. Enjoy. Hey, what's going on, everyone? This is Dr. Ryan Balmes, sports physical therapist with Endvr Health. This is the Endvr Health podcast. This is episode number 2. Consistency is key, and really, you just got to do it. You just got to go out there and do it, no matter how crappy you may be feeling. Having a weird tickle in my throat, so it doesn't feel great. Hopefully, you can't tell through the podcast on the voice. I'm not that good with editing on GarageBand just yet, but maybe when I figure it out, I will, to be able to change my voice. Anyways, welcome to episode 2, number 2 of 2019. I hope you all are doing well. Hope you had an awesome Super Bowl weekend. Last I recorded, that was a fun game, wasn't it? Probably not. Well, it depends on who you are. If you are a Patriots fan, it was really fun. If you were everyone else, it was an awful game. And for the record, I am a Seahawks fan. Maybe I could get into that as to why I am, but I am a huge Seahawks fan, so it was painful to watch the Patriots. But for someone who was a fan of defense, it wasn't that bad. So let's do a quick segment here for the Endvr Health podcast. Let's do an injury report. I'm a big NBA fan. I've grown up watching the NBA. I've played basketball. I love the game. I haven't played it in a while, but I always love playing it, and I actually do still enjoy watching it. For the record, I am an Orlando Magic fan, aka Orlando Tragic, although they are putting up a pretty good tear right now. They're trying to decide whether they want to get to the playoffs or still tank. But either way, I'm a big fan of basketball. So on today's injury report, let's talk about Kyrie Irving. Kyrie Irving has been reported with various news outlets that he's going to undergo an MRI for his knee, his right knee. And maybe in the video I'll be able to put the clip on or something if I could figure it out. But if you watch it, go ahead and Google it and watch it. All he was doing really, would I classify it as a non-contact injury? Yeah, I think I would. He was coming around off from the baseline, I believe, and coming up to the top of the key, which is pretty much the top of the three-point arc, if for those that aren't familiar with basketball. But he was coming up, trying to get through defense, and he was going from right to left, so he was on his right foot, trying to move out to his left to avoid a defender, and that's when he tweaked his knee. There wasn't really much contact. He was trying to avoid someone, but at the same time, he was trying to follow the ball and get to that top of the key, and that's when he made that transition from his right foot to his left foot is when he started jumping on his left foot. He didn't want to put any weight on his right, and the initial reports were it was a knee sprain. And that's pretty accurate. That's actually a lot more than maybe some injury reports will tell you. Some will just say knee pain or knee injury, but knee sprain is pretty specific. And when we know it's a sprain, we know sprain is in reference to a ligament. So anything that has sprain would be a ligament. So all the white connective tissue anywhere in your body. And for this one, it was a knee sprain. So already, as a physical therapist, as I see that, and for any other medical healthcare professionals, when we're thinking sprain at the knee, there are several ligaments that could be implicated here. Now, remember that the sprain is different from a strain. Strain would indicate a muscle, so a muscle strain, you strain the muscle. There are 3 grades of a muscle strain. Grade 3, the highest, would be pretty much a muscle tear. But in this case, it's a knee sprain. So for the Celtics staff, medical staff, they likely already did the special test, the hands-on special test that they do. It gives an idea as to what tissues are implicated. But again, well, like we've talked about probably in the previous podcast, this is a multi-million-dollar athlete. They need to know absolutely what they need to do with that patient or the athlete. What tissues are implicated, what they could do, because for their purposes versus someone that's a recreational player, they have a more heightened timeline. They need to decide Is he going to be able to still make the playoffs? I know the Celtics are struggling a little bit. They did give up that huge double-digit lead that they had to the Clippers. But they need to decide what they need to do with Kyrie Irving. So an MRI was reported recently, and this is what the MRI will likely tell them. The MRI will tell them which tissues are implicated. If there is a tear of any sort, it will show up on the MRI. There are some clinical signs that will already give them an idea as to what kind of tissues are implicated. So let's say he tore his ACL. Well, if he tore his ACL, that knee will immediately swell a lot. I was assuming, and I'm not really familiar with his injury history, but if he had his original ACL intact and he had tore it, that knee will balloon pretty quickly. And for reasons being in that the ACL has a small blood supply, and so when you rupture it, blood's going to be gorging everywhere and the knee gets really swollen, things like that. If, let's say, if it was a meniscus tear of any sort, which I'm probably thinking it may be, who knows, then that knee will likely swell up later, much, much later, so maybe around 2-3 hours afterwards. So those are some of the clinical signs that the medical staff would be able to determine. And again, because he's a multi-million-dollar athlete, he's a prized asset to the Celtics organization, an MRI will give a more definitive answer as to what to do from there. It'll give them an idea as to whether surgery is indicated, meaning do they need to do surgery, or is it something that they can manage conservatively. Either one of those will give you an idea as to the timeline as to what to return. If there's no surgery indicated and all it really was a knee sprain of a ligament for whatever reason, and it needs conservative care, it's going to take time. Now, I've said this before in a lot of my clients, and that when you sprain a ligament, it takes time. It could take almost up to a year for the tissue to fully, quote unquote, heal, if you will. Now, that doesn't mean you'll have pain for a year, and it doesn't mean that you can't play your sport for more than a year. It just means that even, let's say, when you feel strong and ready and able to get back to the sport that you want to play, that ligament's still going to be going through some sort of healing process. Compare that to a muscle strain. Muscles with the rich blood supply heals a little bit quicker, and so that's why oftentimes when someone has a muscle strain, you're able to bounce back a little bit faster and be able to play the sport that you want to play. Looking at the video when I was looking at it earlier today, it was non-contact. He was going from his right to his left. He had to, if you look at the video, had to almost kind of turn his body to the left, so a little left rotation at the trunk. And for that reason, and he also had to pay attention to the ball handler, his right knee, for whatever reason, kind of gave out on him or twisted to the point where his knee did not like it. And I was looking at it, I guess my best guess would be that he sprained his ligament on the inside of his knee, aka the MCL. So with the MCL, not often will they ever really do surgery on it. So if it's a sprain, he's going to be feeling it for a while. Some taping can help stabilize it, but he's going to have to get back to just some rehab exercises to get back to basic motions, to running and jumping, and then ultimately knowing how he feels and whether he could play at that high level. So with something like that, it really all depends. The All-Star break is coming up, so if I was on that medical staff, you could also consider that. If the All-Star break is coming up, he can take these next few I forget when the All-Star break is coming, but knowing that it is, if they could afford to have him out and rest him, then they could do that. And he may even be able to sit out for the All-Star game. Because really, if you're the Celtics organization, the All-Star game is great, and I'm sure Kyrie Irving would love to play, but knowing for his health and for their playoff run, they're likely just going to rest him. There's really no point in him in playing in that exhibition game. And the timing is, if you could say it like this, the timing is great in that with the All-Star game coming up, he'll be able to have plenty more rest and not really miss as many games. So we'll be on the lookout for that. Maybe on the next podcast we could talk about more as to his return. If you have any more suggestions or anyone else or any particular sport or player that you'd like to hear more about on this segment of Injury Report, you just let me know. So I wanted to talk about in terms of what physical therapy is today. Physical therapy is something that I obviously have a love and a passion for, and I promise I won't bore you with really the more minute details of physical therapy, but I really want to make a concerted effort to share with you what physical therapy can mean to you and how is it really different from other medical professionals and how its approach is, it really is different from the traditional approach or quote unquote medical approach to musculoskeletal care or your injury. And really, so physical therapy to me, it's a personal process, and a lot of healthcare professionals will say they individualize it and things like that. And it's true. Most healthcare, and if not all healthcare professionals, have to take into consideration everything that makes you you, what makes you unique. I'm proud to say that as the physical therapist, I really emphasize the more therapy side. And, if for anyone that's maybe gone to more like a therapist in terms of like your mental health, I kind of look at it the same way from a physical standpoint. We take into all the considerations as to what is it that you want to do physically, movement wise, and then we also take in consideration all the other things going on in your life because that's going to be really important. Health is more than just how strong your quadricep is. There's goals, there's aspirations, there's life demands that we have to work around. And as the physical therapist, I serve as your guide as to how you get from A to Z. And so I posted something on our Instagram last week with the word patient crossed out. And that's one of the kind of mindsets that we approach here at Endvr Health is that you're not our patient. Like patient's very old school in terms of the term, and that back in the day in terms of from a medical model, you, the patient, are pretty much this, I don't know how you say it, but like you're just this peon where then the medical person is this know-it-all and end-all be-all of medical and health. And so, that person will prescribe what to do and you just kind of take it. You trust their instincts and you trust their medical diagnosis and all that. And that's all still true, but I like to switch it around and give the different paradigm change in that as a client, you come to us for our guidance and professional guidance and services, but we always make sure that we're in accordance to what your needs are. This is not. This is also a paradigm in terms of passive versus active. In the traditional patient and medical model, it's a very passive approach. You come to the medical expert, they give you what you need, and then you just take it. You just take it, and if you don't do what they do or what they prescribe, then it's on you. Like you should have done it. But it's a very passive approach. You don't actually take any consideration of what you need, or there's really no participation in terms of your input as to where to go with your healthcare. But here, at Endvr Health, like the physical therapy side, we really approach it as a client relationship, in that we take everything that you want and need and your personal considerations into account, and then we create that treatment plan for you. So that active and passive is going to be key. Now that we do some passive treatments, and that pretty much means anything where you're not doing anything, whether it be joint mobilizations, dry needling, maybe taping. But really, ultimately, most of the therapies, if not all, is going to be circling around active treatments and approach. I mean, take for example, if let's say you have low back pain or tendonitis or a muscle strain, ultimately you're going to need exercise. Exercise is going to be an active approach. You have to be doing the exercise. I can't be doing the exercises for you. So it makes it seem like, well, if it's all just exercise, I could do it myself. And while that is true, we as a physical therapist really just serve as to which exercises you exactly need to do. There's no guesswork. It is individualized and customized to what you need. So if you're a runner, a lot of the exercises that I would prescribe to you would be very running specific, running movement specific. If you were a CrossFitter, it's going to be very specific to the high intensity demands as a CrossFitter. So that's really where the physical therapy experience really comes into play, is that the exercises or interventions that we're looking at and talking about is going to be highly, highly specific to you. And to be quite honest, if I could be really honest here, it's one of the reasons why it's not a pet peeve, but it's just a professional irk of mine why I have trouble prescribing or helping people on social media about injuries, because injuries can be so specific, and I would rather be very individualized and give out a broad brush of this is what you need to do for this. Because more often than not, it's not likely going to work for you because I'm not able to truly individualize it. So if you followed a lot of our social media lately, here at Endeavor Health, we vow really not to do that through our social media. We give more proactive approaches to your health, meaning that you are quote unquote healthy, you're not in an injured state, you don't have any significant pain. So a lot of our social media will be geared towards how do you stay healthy, because really injuries are a sucky experience, but if we could prevent them altogether, that's really going to be the name of the game. And then that way, if you do need to see us here at Endeavor Health, your time is well spent, that we're really honing down on really the nitty gritty specifics of how to get you out of that injury. Now, to stay out of injury, those are free resources that we'd be happy to provide out here on our social media pages and content in terms of how to stay healthy, because that's really going to be the name of the game in really just long-term sustainable health. So shifting up a little bit, if we wanted to stay healthy, we could definitely talk about building muscle. Now, I've been asked that in terms of how do you build muscle, and simply put, you have to give stimulus to your muscles. You have to give some sort of resistance training or activity to your muscles so your muscles understand, hey, I need to change and I need to adapt to what this body is doing. So if, let's say, you have not been exercising for years and you started doing squats, even body weight squats for a certain amount of reps, your body will start recognizing, hey, there's something happening here through these muscles and I need to change and adapt so that the next time he or she does these squats, I'm ready for it. And it goes back to the earlier podcast that I've done in terms of the capacity versus load. Once you place a load through your body, the body will respond and it wants to get better so that it could be prepared at a higher capacity for that upcoming load. So with that being said, building muscle improves your overall capacity for your sport and for your life. I know I talked about in the last episode in terms of gravity will never change as we get older. And at the very least, if you're out there to build muscle, not so much for any specific sport or activity, at the very least, build muscle so you can always maintain the right amount of capacity to stay against gravity. And we want to stay against gravity because there's a lot of things that we do, especially as we're getting older, that we need to make sure we can fight against gravity. I think going upstairs and going up curbs is probably the biggest one that we would do in our everyday life. Maybe even stepping up into your big SUV. That's another thing that we always have to do in terms of always fighting gravity. And so you need the muscle capacity to do that. So building muscles requires a stimulus. You will need to have heavy, intense weight training through that. You could build it through with lighter weights, but ultimately if you're wanting to build strength, you're wanting to stimulate the muscle, you're going to want to have a high intensity load through those muscles. Traditional guidelines say if you have a 1 rep max, so imagine if you're trying to bicep curl and you're trying to bicep curl something really heavy that you could only manage to do 1 repetition, that would be the definition of your 1 rep max. Traditional definitions of true strength training would be about 70 to 80%, even 90% of your 1 rep max. So you're pushing your muscles close to the limit, if not at the limit, to build that strength. And when doing that, that helps the muscles recognize, whoa, this stimulus is pretty heavy, and I need to make sure I'm building my capacity to be able to get better for the next time. Not only do you need the exercise stimulus, you need to be able to fuel those muscles so that it can build. And so the basic essential building blocks will be protein. So protein supplementation and making sure you get adequate protein in your nutritional diet is going to be so important, not only for protein, but also the necessary amino acids, building blocks of those proteins to help build that muscle. So if you are new to the exercising game, new to the strength training game, you got to make sure that you're getting the right exercises to build the muscle, but then also adjust your diet so you're gaining all the necessary proteins you need. Sometimes it's as simple as getting a protein shake. You don't have to get too fancy. I don't want to get into the weeds in terms of like the specifics of protein. Maybe I could save that for a next episode. But I know for me personally, I just enjoy one protein shake soon after I finish working out. And oftentimes, if in your diet, just take an analysis of your diet. You're probably already eating plenty of other sources of protein, lean chicken, red meat, fish, things like that. Don't forget some vegetable options for protein. You have beans, you have nuts, peanut butter is another option. So there's definitely other ways that you can get protein without having to maybe go to meat if you'd like. So when you're building your muscle, you're looking at the first 1 to 2 weeks is going to be purely your nervous system, believe it or not. You are actually improving your nervous system to fire from the brain to the muscles on how to contract, which is actually really cool if you think about it. So for the first few weeks, the muscle changes are going to be, or the muscle strength that you experience, such as, oh, wow, I could lift a little bit heavier, will actually be more from a nervous system adaptation. And then from 4 to 6 weeks, that's when true muscle size will happen. That's when the muscles and the body has recognized, okay, I really need to commit and dedicate to building these building blocks to your muscles. And so that's where the hypertrophy or physical changes are going to happen, which is 4 to 6 weeks. So that's kind of the timeline that you're looking at. If you're looking at it from a long-term standpoint, that's when a proper training plan will take into account different phases of your training. And so again, for any of the runners out there that I like to work a lot with, or if you're training for a specific sport or activity or one event, you're going to want to make sure you give yourself months before that event or activity or season to build up as much muscle as you can, because it's very hard to do so either during the season or pretty much when you're at the event. You're not going to have time to build muscles at the event. So take, for example, I'm running the Gate River Run in Jacksonville with my brother in a few weeks. I'm doing my best to stay training, but at the very least, I'm building enough muscle so that I could take that load and build my capacity so I could take that load for that 15K run. And so that had to start months before. So to all my runners out there, out here in the running community, if you are looking to run, especially for the Peachtree Road Race coming up right now, and if you are not training right now, which is perfectly fine, if you're not out there gaining your miles because you know you've ran it before, at the very least, the thing that you can do is strength train. Start going for more compound movements, which is squats, deadlifts, maybe even leg presses. Start building your core. Start building your rectus abdominis, some of your obliques. Start building those muscles because those are going to help overall on your running performance. Start building up your back muscles, latissimus dorsi, your rhomboids, your middle traps, the muscles in the back for your upright running posture. All that's going to help so that when you do start running, again, you've built that capacity to take in that load for running 30, 40, 50, even 60 minutes on end. So again, that's really the kind of the planning that I preach. And believe it or not, it's really going to apply to a lot of sports and activities, because really if you have that preparation in your body and you prepare adequately with the muscle strength, you'll be able to have the capacity to do anything that you'd want. All right, well, I think that is the end of this podcast episode. Let me know what you think. I'd love to hear your feedback. If you have any topics or ideas that you'd want to hear covered, let me know. Again, new segment with the injury report. If you have any specific sports or injuries you'd want me to cover, let me know. This is Dr. Ryan Balmes, sports physical therapist with Endvr Health. Thank you for listening to the Endvr Health podcast, and I'll catch you guys on the next one. See ya.